Hello and welcome. Thank you so much for joining today's discussion, where we're going to explore the real life impact of a significant diagnosis on patients and their families. I'm Beth Moore, Executive Vice President of Corporate Communications with the Patient Advocate Foundation, and I'll be your moderator today. Patient Advocate Foundation, we're a national 501c3 nonprofit organization committed to the delivery of case management services and financial assistance to patients with chronic, life-threatening, and debilitating illnesses. In 2019, our professional staff served more than 145,000 patients from all 50 states, and it's through this experience that we bring this topic to you today. I'm so pleased to introduce my esteemed colleagues and today's panelists, Dr. Rebecca Angove, Kathleen Gallagher, and Pat Jolly. So Rebecca is our Vice President of Patient Experience and Program Evaluation, where she leads efforts to identify patient needs, translating those needs to direct service and policy recommendations. She received her PhD in Public and Community Health from the Medical College of Wisconsin in Milwaukee. Ms. Gallagher is an epidemiologist and health services researcher, having earned her Bachelor's of Science in Public Health from the University of North Carolina at Chapel Hill in Environmental Science and Engineering, and her Master's of Public Health in Epidemiology from Emory University in Atlanta. She currently serves as our Senior Director of Health Services Research at PAF, supporting the organization's mission through population-level quantitative research projects. And Pat Jolly, who is our Senior Clinical Director, she stays abreast of advances in medical treatments, collaborating and mentoring our case managers as they assist patients through the healthcare delivery system. Also, as a registered nurse, Pat is able to share her experience in intensive care, oncology, utilization review, and case management, making her an excellent point of reference and an asset to the organization. So welcome to all of our panel members. Thank you for joining us today. So through our extensive work with patients over the course of the past 24 years and the intentional evaluation efforts of data that's been called through both services and survey activities, we recognize very clearly that patients and their families often experience significant financial distress that result from the management of both medical and non-medical expenses, as well as work disruptions that are often a result of illnesses. And Rebecca, can you help us understand the scope and significance that financial factors have on patient access and decision making?
Yeah, absolutely, Beth. So we know that healthcare, the cost of healthcare have been growing and increasing, but the out-of-pocket cost for patients has also been increasing, and that's deductibles, that's their copays, their coinsurance, those out-of-pocket costs, and also just the amount that they're contributing to the annual insurance premiums. And this really is challenging, especially when a patient is diagnosed with has a serious diagnosis. What we've been really seeing is that patients, to deal with these increased costs, they're delaying care, critical medications or critical treatments, and aren't adjusting how they're receiving or seeking care. They're actually going into severe financial distress to get the care that they need. So they're going into debt, they're losing their houses, they're wiping out their entire retirement and savings just to afford the care they need. And we know from working with patients that most patients aren't prepared or even aware of the financial implications of these diagnoses. And really, providers aren't doing a good enough job communicating the cost of treatment with their patients. And so, patients, they're hit with a diagnosis, and then, the second wave comes where they're really starting to see the financial just increases the burden on patients trying to get healthy.
Thank you, Rebecca. And that really does help frame our discussions today. And it brings us to a point where I want to bring Kate into the discussion. And Kate, recently you conducted a study to evaluate the financial distress levels of patients that were served by Patient Advocate Foundation. And I was hoping that you could talk with us a little bit about what you found through your discussions with those folks.
Absolutely, Beth. So knowing that many of the patients that we serve are experiencing some sort of medical or financially related crisis, it wasn't surprising that almost a third indicated just general distress in the past 7 days, and that 1 in 5 felt an overwhelming level of actual financial distress. For many, the overall financial cost of treatment was very concerning. In fact, almost 75% of patients mentioned this. So it's real. It's out there.
Thank you, Kate. And it really is. It's so sad to hear these numbers. And so, Pat, I want to jump in and have you join the discussion and talk a little bit about the resources and the services that Patient Advocate Foundation brings to bear to help mitigate some of these distressing ramifications of medical debt. So can you talk a little bit about what your case management team does from a practical standpoint to help patients?
Absolutely, Beth. So our case managers work one-on-one with the patients to assist them with their medical expenses. We make phone calls, write letters, and do much more on behalf of the patients. Oftentimes, hospitals and medical providers have financial assistance programs, but they're not well advertised. So we go out and look for these programs and help the patients through the application process to try to find the patients some relief. Once that's done, we look and try to help the patient set up affordable payment arrangements on any remaining balance, and when able, see if the providers are willing to provide a prompt pay discount if the patients are able to pay the remaining balance once all the payment arrangements are in place. If the patients are able to get financial assistance or from one provider, we always tell them to mention this to the other providers they're working with to see if those providers are able to make the same discount available to them on their balance. And we always encourage patients to use their network providers whenever possible so that they can help decrease their out-of-pocket expenses. If the issues are related to medications, we go and look for copay assistance or manufacturer programs that may be available to assist the patients with getting their medications, as well as a lot of other on the internet resources. And we have a lot of information available on our website, as well as a publication called Negotiating Medical Costs that provides some helpful tips on how to stretch your healthcare dollars.
Thank you, Pat. Really important support. And so, it's interesting because we've seen through our case management experience that most folks tend to think of financial issues related to medical expenses, and that's what comes to their mind. But they don't often realize that there's a very significant and serious second wave, as I call it, of financial distress that occurs. And that's when folks start to hit a barrier around non-medical expenses. And Kate, I know that you did some survey work around that very topic of how non-medical issues impact patients and their family. Can you talk to us a little bit about that study?
Yeah, Beth. So we know that non-medical costs are incredibly important to consider since most Americans are paying more out of pocket for their care, and this leaves fewer dollars to cover their basic household needs. So when we asked about how Patient Advocate Foundation could help them with financial needs, day-to-day living expenses was actually the top response for over 40% of our patients. This was followed by caregiving, transportation, and food security. Specifically around food security, 12% of our patients rely on support from the Supplemental Nutrition Assistance Program, or SNAP. And to actually receive support from SNAP felt that it had a major impact on their ability to address the financial challenges related to their illness. So these non-medical support systems are crucial to helping patients get well.
Oh, you're right. You're right, Kate. Safety net services and finding access to those important resources are just critical. And so, Pat, when you think about the provision of one-on-one assistance that our case managers provide, what specifically does our team do? What do case managers report back to you as ways that they intervene and effective interventions that they take when they're addressing those basic necessities with patients and their family members?
Well, for patients contacting PAF in 2018, patients who are reporting the inability to pay for their rent or mortgage as well as their utilities among the top 10 issues that they were experiencing. So the case managers go out and look for local, state, and national resources that may be available to help the patients. And depending on their diagnosis, we can investigate some small grants that might be able to assist in helping patients get through some rough patches. As far as the mortgage goes, when the case managers work with the patient and their mortgage lender to help to see if they're able to defer a payment or make a partial payment, and then be able to catch up on back payments when their financial situation improves. If the reason that they're having difficulty paying their expenses is because of a diagnosis, we're able to provide guidance regarding the disability process as a gateway into some of the safety net programs that many people are not aware of, or if they're aware of them, they're not quite sure how to access those programs. So the case managers are able to walk them through that process. PAF has a directory of financial resources for both insured and uninsured patients that are available on our website. It's called the National Financial Resource Directory. It's got some great information, and we encourage you to check that out. And based on patient's diagnosis, we may be able to refer them to one of PAF's other programs, which is for financial aid funds, and this provides small grants to help with basic needs and transportation expenses.
Thank you, Pat. Thank you. And Rebecca, I want to turn to you now from an evaluative standpoint. And I understand that you've done a lot of work with the post-encounter evaluation to uncover the impact that PAF support services, as well as our nation's safety net services, are having on patients and caregivers. So can you talk to us a little bit about the impact of those interventions and what they mean for folks?
Yeah, absolutely. So, to begin with, the services that we provide, the case managers, it really is essential to helping patients. We know that it reduces their stress, not just financial distress, but it reduces their general distress and stress levels. Having somebody in their corner to support them and to help them through one of the most challenging times in their life, often, and navigate all of these different services and resources that are out there, patients report as being very valuable and really key to helping them achieve their healthcare goals. We also know that these services help patients really understand and navigate a very complex healthcare and insurance system. This whole ecosystem is hard for individuals that, let alone patients that have not had any experience navigating and are doing this for the first time. So really the education piece and the navigation piece is key. And then when we find them resources, so Kate was talking about the non-medical costs, and Pat was, sharing some of the resources that we access and find for patients. Our numbers show that on average, patients that call with non-medical cost-related issues, so those cost of living expenses, we find and help patients access on average about $500 per case. So we're really successful in helping patients find those resources that are out there, not just find them, but also, apply and access those resources. We also find that patients that work with our case managers, we see their engagement in care and their engagement and activation within healthcare increase, which is really, really important. And it also helps patients become stronger self-advocates. So we see a lot of positives from the patients utilizing our services, and really a key essential service that many patients need.
Thank you so much, Rebecca. I recently saw a data point that was so shocking, but exciting at the same time. That in 2019, our case managers, their efforts resulted in more than $24 million in relief to patients through their interventions, through their connections with safety net services, or resolution of billing issues, coding issues. And that's just, again, it's really unbelievable. So
yeah, when you look at our medical cost related, that average that I talked about, that $500,
yes.
actually, when you wrap in the medical related cost reduction and resources, it jumps up to $5,000 a case. So our staff has done an amazing job with the patients they serve.
That's great to hear. It really is. Well, so we understand that there are some patients who, unfortunately, due to the effects of their illness or the side effects of their treatment, they're going to move to a place where they're unable to work or work at their current levels, and therefore they encounter work disruption. Obviously, when folks reach that point of work disruption, they face a whole new host of challenges. And so many Americans are reliant on their jobs for their health benefits, for other benefits, as well as for their income. And Kate, I know that you've explored this issue in depth, and you've asked patients very candid questions about taking time off work. What did these conversations uncover? What did patients tell you about this work disruption issue?
Yeah, so Beth, we did ask patients a series of questions about the impact of their diagnosis on their ability to work and their insurance coverage. And we know that over half of the respondents mentioned that their ability to work was compromised. In fact, 75% of the patients took at least 2 months off of work, with the vast majority taking over 6 months. Like, that's half a year away from their job. To cover these absences, multiple types of leave were utilized, and this could be unpaid leave, it could be sick leave, paid time off or vacation, short-term disability, long-term disability, and the Family and Medical Leave Act. And then of those who had their insurance coverage impacted, over 90% stated that their diagnosis and treatment changed their employment, and a third had their insurance coverage changed. So it's a good chunk of patients. Work and the insurance linkage to it is important.
So this seems like a real crisis point in a lot of ways for patients then. Not only their household is their household dependent upon it, a lot of times their benefits are dependent upon it. So Pat, can you talk to us just a little bit again about what your case management team specifically, what practical steps do they take on behalf of these patients when they reach this point and they come to PAF for help? What can our case managers do to help eliminate the challenges caused by work disruption?
That's a great question, Beth. So one of the nice things about the case managers is that they're able to look at each case as each patient individually. And so depending on their diagnosis, if they have a qualifying diagnosis for some of the safety net programs, such as Social Security or Social Security Disability or SSI, we can assist them with getting their applications in. The nice thing about these programs is both of them actually do come with some insurance benefits that the patients may be able to tap into. Depending on the severity of the patient's diagnosis, we may be able to assist them in getting their application expedited through Social Security under a process known as compassionate allowance, which shortens the amount of time before they're able to actually get a decision about if they meet the criteria for disability. There's also some state employment temporary disability programs that do bring income so that patients are able to purchase health insurance through the state and federal marketplaces, as well as maintain their current insurance that through a program known as COBRA through each employer. And we do look for other cost savings programs such as extra help and low income subsidy through Medicare, or we look at each state Medicaid eligibility criteria and see if some of the states have expanded Medicaid, the patients may be able to qualify now and for those programs and maintain their health coverage.
That's great. That's great. And can the case managers, Pat, at all, can they talk to patients a little bit too about what their workplace provisions might be, or some federal regulations that would allow them to have some protection when they're going through treatment?
Absolutely.
We can have.
Those are discussions we have with patients on a daily basis. I think that oftentimes somebody had mentioned, one of the girls mentioned that this might be the first time these patients are even experiencing any kind of medical hardship. So we educate patients about some of the programs that they're entitled to through their employer, such as the Family Medical Leave, the Americans with Disability Act, and there's a lot of other programs that we're able to actually talk to them about, gave them some information, and point them in the right direction on where to get additional information.
That's great. Thank you, Pat. And Rebecca, I want to turn to you and just, now that we've looked at this comprehensive set of cost-related barriers that have been identified, what are your direct service or policy recommendations for patients and their families in the future?
Well, there is policy work being done around price transparency, but it's moving slowly. So my biggest recommendation is, if there are providers watching this, to really find ways for you and your care team to have these cost conversations with your patients and start talking about both the medical, the direct medical, and the non-medical costs and financial implications of treatment and a diagnosis. And my recommendation to patients is the same thing. Don't be afraid to talk to your providers. Find ways to talk to your care team and your providers about some of these financial related topics. I know it's hard to talk about money, but being prepared and starting to ask some of these questions and have these discussions with your provider is very important, as well as with your employer, and getting to know what some of these resources are. I also think that if you're not getting the information or the answers that you need, to make sure that you're reaching out to somebody like PAF for help and support. We can help you navigate some of these really challenging systems. And then I think patients can really help each other. So patients that have been through it can really help advocate and teach other patients and support other patients going through it. So we have opportunities for volunteer. A lot of organizations do. Our sister organization, the National Patient Advocate Foundation, has a network of grassroots advocates. They're doing work to support community, state, and national policy changes. So if you want to get more information about that one in particular, you can go to their website at npaf.org and just click on the volunteer button up in the top right.
Thank you, Rebecca. Thank you so much. So it looks like we have a couple of audience questions coming in at this point. Please feel free to send others along. One question that I'm seeing involves medication copays. Apparently that's a significant issue. Pat, or is there someone on the panel that could talk about potential resources for medication copayments in specific?
I think there's lots of resources available. There's the ones through the actual drug that whoever makes the program, that manufacturer may have assistance programs, as well as talk to your insurance company, see if prior authorization is required, see if there's any other medications on the drug formulary that may be covered. This is one of the discussions you'd want to have with your medical provider once you find out what the cost is. If you can afford it, and we don't want you to feel like this is a barrier to continuing your treatment once you've started it. There's a lot of copay assistance programs too that are disease or drug specific that are out there. If you Google your drug and see if there's any assistance programs, you go to any of the disease specific organizations, they'll oftentimes give you that information on if there's any assistance programs available. And also check with each year as your new insurance policies are coming up, you want to check with the benefits that are available and see if you have a separate medication deductible along with your medical deductible. And if there's an option to get a different type of plan for the next plan year, you may want to explore that during open enrollment.
Thank you so much, Pat. It looks like we have time for just one more question, and let's tackle the one about open enrollment. I see several questions relative to open enrollment. Pat, can you talk to us about when Marketplace open enrollment starts? Do we know when Marketplace open enrollment begins?
Yes, we do.
Okay. Right.
Open enrollment for the Marketplace begins on November 1st and goes through, I believe, December 7th. I don't quote me on that final date, but the new plan year starts on January 1st for the new plan year. If you have a loss of employment or change in your employment during the year and lose your insurance benefits, that may be a qualifying event, and you are able to change your insurance plan at that time, and you potentially could get on the Marketplace if you're losing other healthcare benefits at that time. As far as employer-sponsored groups go, that depends on the actual employer. You'd want to check with your Human Resources Department and see when their actual open enrollment is and see what other plan options are available to you at that time. And some of the other, depending on your diagnosis, there are some programs out there that can assist with your premiums for your health plan. So you want to check and see if that's available for your specific diagnosis as well, if you meet those criteria. For Medicare, open enrollment goes from October 15th to December 15th, and again, the new plan starts on December 1st for most Medicare, and then there's a Medicare Part D open enrollment in January to February.
Wow. Thank you, Pat. Information that is so helpful, and it sounds like open enrollment could be a discussion in itself. So
it is an actual.
Yes, it is. It is.
It is.
So, well, I want to just pause here and thank all of you who attended today's discussion. Thank you to all of our panel members so much for participating and sharing your insights on this topic with us. I want to encourage everyone to please visit Patient Advocate Foundation's website at www.patientadvocate.org. You can also call us if you need direct assistance at 1-800-532-5274. And again, thank you so much for your time. This discussion will be available on demand at a later date on our website. So if others could benefit from this information, it will be available. Thank you.